My name is Caroline Guindon, and I am a doctorate in athletic training student at Indiana State University. And today I'm going to discuss utilizing the prone forearm plank as a screening tool. To give you a little bit of background information, when I was originally researching the prone forearm plank, I was looking for a screening tool for the volleyball population. In volleyball, 4.8% of injuries are related to low back pain, which oftentimes is caused by core instability. It has been determined that core instability can lead to an increased risk of shoulder pain. This is where the prone forearm plank comes in. It is an activity that effectively activates the trunk stabilizers that are so essential in having good core stability. Looking at some of the psychometric data, the prone forearm plank has very good test-retest reliability and moderate inter-rater reliability. Unfortunately, it's very difficult to determine what the validity of this test is because there is currently no gold standard for testing core stability. When we're going to be performing this test, the timing starts once the patient has come into the proper positioning. The patient is going to maintain this position for as long as possible, and when they can no longer maintain this position, timing is stopped. Verbal cues are provided if the patient needs based on them altering their position. If there are two consecutive cues that are given without correction, then the test stops. The test also stops if the patient is fatigued or voluntarily stops, if the patient fails to maintain the proper positioning, if the patient experiences ill effects, or ill effects are noted by the clinician. In this clip, I'm going to have my patient demonstrate some good form versus poor form for the prone forearm plank. To start, you want to make sure that the patient has their feet together as well as their lower legs together. Their toes should be pulled under their feet with their ankles in a slightly neutral position. Their elbows should be directly under their shoulders, and their forearm should be straight out in front of them. When they come into this position, you want to make sure that they're maintaining it for as long as possible. You want to look for a flat back, as well as having the shoulders, hips, and knees all in alignment. Now, moving into more poor form, you want to note any shifting of weight between the arms or legs, lifting one limb off the ground. You also want to look for anterior tilt of the pelvis, posterior tilt of the pelvis, as well as a lordotic curve of the spine where you see dropping, or kyphotic curve where there is more bridging. You also want to note when you're performing this test to have your patients wear slightly fitted clothing as opposed to a jersey or basketball shorts, so you have a better view of their form. Again, going over what I demonstrated in the brief video clip, positioning for this screening tool, the patient is going to maintain the static position for as long as possible with only their forearms and toes touching the ground. Their feet are going to be together, elbows forearm distance apart, and the humerus directly below the shoulders. The forearms are going to be in neutral, and the hands are going to be in front of the elbows. When looking at scoring for this test, an article by Strand determined that the average length of the test for athletes was 104 seconds, while the average length for non-athletes was 83 seconds. This comparison between athletes and non-athletes was the only significant finding in this study. The times I have listed at the bottom of this slide with female athletes, male athletes, female non-athletes, and male non-athletes are also averages that were found during the study. However, none of these comparisons were found to be significant. Regardless, I have included them because I believe it is important to understand that there are different averages based on different populations. At this point, I believe that clinicians can use their expertise to determine which standard they are going to use in the patient population that they are implementing this tool with. With implementation, This is a test that requires very little equipment, only a stopwatch and an open space. Luckily, nowadays almost everyone has a stopwatch on their phone, so there should be no expense to be able to implement this test. It's also very quick. The average test length for the male athlete was 124 seconds, which is just over 2 minutes. So again, this is a quick test and quicker depending on the patient population that you are implementing it with. It's also very easy to score. You simply take the number of seconds that the patient was able to maintain their positioning and use that as their score. And it can be used as a standalone screening or as a baseline. It can be incorporated into a pre-participation exam or after impact testing. It could also be done prior to a practice. However, you do want to be aware that if it is performed after a practice or conditioning session, that it may not be as accurate because your patients may be fatigued. These are all of the citations that I used throughout this presentation. Please look into them if you want more information. Thank you for joining me.